So basically the patient has basically, as you know, the radiographic features is very important for us when we have to basically identify the severity of lesion sometime, or which type to identify whether the lesion is present and how. So radiographic features basically, like, patient will have, like, in the radiograph, patient will have the radiolucency at the apex region here, like this, and it will be blackish in color. So that luminosity will be blackish in color. Okay, so very important, it will be radio opaque. Second, basically due to the uh, okay, so basically due to undergoing acute, the condition, when the condition of granuloma is worsened in chronic, so there is less demarcations between a bone and granulation tissue, and due to long standing granulomas, it causes hypercementosis, mean there will be the cementum will be more deposit, there will be, due to which there will be a bunting of the root tip. You can see it here is radiolucency. Either RCT remove the apex or extraction. Now, the sequel of the acute periodontitis, it is acute periapical abscess, acute osteomyelitis, acute periodontitis, cellulitis, and round wings angina. Moving towards the periapical abscess, as you all know, basically it is the initial lesion that develops if acute periodontitis remain untreated. When patient has an acute periodontitis, it causes abscess in okay, this acute, and it is basically the progression of the acute pulpitis, mean it comes from the, when acute pulpitis leads to the acute periodontitis, so we have abscess formation or extraction of the exudate, or when the exudate is basically spread into the soft tissues, hard tissues, or worsened by a chronic granuloma. Okay, it is, this condition is worsened when also the patient has granuloma. So in that granuloma, the patient can even develop abscess. Now we will study how. You can see the gums are inflamed when the periapical abscess are present. You can see it. Now ethologies, you will say that we were saying that in acute, in a chronic, it was granuloma. So how the abscess, it is when the granuloma is not treated at the apex of root, the organisms enter in that granuloma, the condition is worsened, patient has acute symptoms, that bacteria release toxins and enzymes and that granuloma, and worsen or lyses of the surrounding tissue, and that lesion becomes enlarged and formation of abscess occur. Very important point. Okay. Okay. Suppuration may occur if there is a severe irritation, means there will be also pus formation if the condition is severe, not treated. Okay, is severe irritation and tissue necrosis. Tissue is necrosed due to the bacterial infection. Acute, okay, for continue and massive exudation of neutrophils, that okay, when there is inflammation, so it will lead to the abscess formation also. This abscess is called acute periapical or alveolar abscess because it will also spread to the bone. So it is very important. The basically sometimes, okay, so you have this root, here is this abscess, and this abscess is actually externally connected to any sinus or any other thing by a tract, that through that tract, that inflammation or infection abscess will be spread into the surrounding tissue. Okay, so it will involve the tissues, it will also involve the bone, and also other clinical features. Pain, the patient has severe pain, and the temperature elevation and malaise. When there is a temperature rise, so it will cause pain, malaise, pain. Okay, tooth will extrude from, of course. Okay, so in, like we were saying, in chronic periodontitis, the tooth will come off the, so it will also has extruded from the socket and displays occlusal interference and have severe pain. If apex is close to the bone, swelling and redness will be present. Of course, as we have show that the periapical abscess, what I have showed to you, that picture. Radiographic, the PDL, there will be what happened on the abscess region. Just in avoid my diagram, but just look at that, the pedial fibers will be at the apex region will be widened initially, and there will be loss of distances of the surrounding, means there will be you will the surrounding bone, the distinction matlab it will hard to distinguish between a granuloma of the between a abscess and the bone. Increased redundancy of bone with time and fitness of tubercle. There will be the redundancy will increase the darkness with the time and fitness of that tubercle. That tubercle will slowly become faint, light. Okay, you can see this abscess. Look at this radiolucency, and also this widened pedial fibers, and you can sometimes cannot distinguish between either which one is your periapicus region and bone, because the translucency is increase of bone with time. Okay, okay, and the destruction between the surrounding bone is then become hard. Okay, histopathology. There will be, of course, capsule, fibrous capsule, and inflammation. So there will be lymphocytes and plasma cells, the zone of granulation tissue. In that granulation tissue, you will have all the inflammatory cells, neutrophils, plasma cells, and lymphocytes, macrophages. You have the central core. That's in okay. So the central core of the tissue will have the liqueficative necrosis and disintegration. The bacteria colonies will be evidentific and anaerobic, and they will have anaerobic bacteria, speculated streptococci can be you see. Now moving to the one of the most important thing.